Hey you guys, welcome back to the Spill Podcast. I am your host, Vivian Rose. So in this week's episode, I have a doctor on here. We're going to talk all about eating disorders. So eating disorders is like a really pretty much normalized thing in today's world, and I just really want to educate you guys on it because it's a big issue for teenagers in these type of days because social media and stuff. And I just really hope that knowing about eating disorders and educating you on it can really help you to realize if you have one and how to recover, and just educate you on them so that you can help someone else that you may know that has an eating disorder. So let's get right into the episode. Before we get into the episode, I do want to go over this week's featured listener. She is so sweet. She DM'd me on Pinterest, and she said, the cutest thing ever. And so this is what she said. She said, "Hi, I just wanted to message you because I'm literally so in love with your podcast, your blog, and obviously your Pinterest. Your Pinterest account is so aesthetically pleasing, and it's so organized and gorgeous. Love all that you do, girl. Keep it up." Thank you so much. That is literally the sweetest thing ever that you could ever say. That's literally so sweet. And it just made me so happy. You guys, I truly appreciate the nice and sweet things that you say about my businesses and stuff. And I really do appreciate, when you guys say, the blog, the podcast, my Pinterest. It just means so much to me. And if you guys want to be featured on next week's episode, DM me or leave a review on Apple Podcast, and I will totally feature you on next week's episode. Again, that is the sweetest thing. Thank you so much, and I appreciate your sweet, kind words. Now let's get into the episode. Hey everyone, welcome back to the podcast. So in this week's episode, I have this incredible doctor. She is so sweet, and she's all about eating disorders, and so she's going to teach us and educate everybody about it. So if you have a friend who may have an eating disorder, or if you may have an eating disorder, she's going to educate you about it and hopefully and help you to encourage recovery and stuff. So you can go ahead and introduce yourself.
Hi everyone, I'm Dr. Dennis. People call me Dr. Kim. I'm a board-certified psychiatrist and certified eating disorder specialist, and I'm the co-founder and medical director of a treatment center called SunCloud Health, which is in the Chicagoland area.
That is so cool. I would love to come and see all about psychiatry, because I really love psychiatry too. It's so fun to learn about all things mental health. I really love it.
Me too. I'm biased, Vivian.
Okay, well, let's get right into the episode. So, question number 1, what exactly is an eating disorder?
So, at its essence, I would say eating disorders are a group of illnesses that affect a person's thoughts and behaviors around food, body image, weight, size, shape, and those sorts of things. And there are different types of eating disorders in what we use as psychiatrists as a diagnostic manual. So the manual we use to, determine what specific illness a person has. And the main types of eating disorders are, in the order of most frequent to least frequent, which is a little bit different than how most people think about them, would be binge eating disorder, where people experience loss of control in discrete episodes of eating, and eat objectively larger amounts of food than would be typical for a person without the disorder. And then we have bulimia nervosa, which is binge eating episodes, loss of control, eating large amounts of food, followed by some way, shape, or form of compensatory behavior. And by compensatory behavior, that could be any number of things, like throwing up, like exercising, compensatory restriction of eating. And then there's also anorexia nervosa, which I think is what most people think of when they hear the word anorexia. It's the least common of the eating disorders. It can be the most medically serious. And anorexia is essentially an inability to take in enough nourishment to keep your body functioning well, keep your brain nourished, and keep you healthy. People with anorexia, regardless of if they're in a larger body or a smaller body, tend to be very perfectionistic and obsessive, and are pretty obsessed with changing the way their body looks and losing weight. They tend to be bothered by thoughts of their body image, and that usually is distorted in the way that they think that they look bigger than they actually are in reality, and in the way that how they look matters a lot to their personhood, whereas people who don't have that, might put a lot more stake in the fact that they're a good student or a good friend or a talented athlete or an artist. Their values are more in tune with who they are rather than what they look like. There are a couple of other eating disorders that I can mention. One is called ARFID, or Avoidant Restrictive Food Intake Disorder. And people who have ARFID typically aren't restricting their eating out of concerns about body image or out of a desire to lose weight. But they typically will have difficulty consuming enough food to nourish their bodies because they're afraid that they're going to choke on the food, or that food will cause them a medical illness, or they can't tolerate, certain textures in food. And what ends up happening is the amounts of food and types of food that they eat becomes very restricted, and oftentimes the quantity becomes restricted as well. And then there's this group of diagnoses called other specified food and eating disorder, which can be a lot of different things that just doesn't meet full criteria for any of those other four that I just mentioned.
That's really interesting. I had no idea there were so many different types of eating disorders. I only really knew about anorexia and maybe two more that you mentioned, but I didn't know about the other ones that you mentioned. That's very interesting to know that there's so many different types. And I didn't know that anorexia was the least common, because the most people that I know with eating disorders, they have anorexia. So I didn't know that.
Yeah. Well, and I think that's typically the case for most people, because the one that people see, with their eyes, or what they think they see with their eyes, is anorexia. And it's also the one that I think in media and press we hear the most about, So I think a lot of people don't really understand that there are a lot of other eating disorders, and that they can be very medically serious and potentially fatal too.
Yeah, it seems like it can get really scary, because you're in the hospital day after day and stuff. Yeah.
Yeah.
So what are some signs that someone may be having eating disorder?
Yeah, so it depends on what eating disorder they have, but if we just in general, there's almost always an impact on a person's social functioning. So, things like friends not wanting to go out to eat with you anymore, or friends going out to eat with you but not eating when everybody else eats, or eating very rapidly and always going to the bathroom afterwards. When people go on extreme, any sort of extreme changes or shifts in how a person's eating. And some of these are tricky to pick up on, because there's a lot of, I would say, sickness in our culture, in American society, around obsession with, clean eating, and obsession with, this myth that in order to be healthy, you have to be thin. So I think a lot of times people are experiencing symptoms of an eating disorder, but don't really even know it, and their friends don't know it because it's just so pervasive. Some of these perverse, in my opinion, ideas about what it means to be healthy. I think diet culture is something that young people are exposed to early and often, through social media, through school, through their medical providers. And some of that can cloud, detection of an eating disorder in the early stages.
Yes, ma'am. And I actually, I love that you mentioned that, because I really don't like how on social media people really push out these extreme diets and stuff, and they push out diets that really, like, they make you look good, but they don't make you feel good inside. And so, like, they may be, like, deteriorating, like, parts of your body, and then, like, killing up your gut health and stuff. Is absolutely terrible. And I just hate how that's so pushed on to young people at this time.
Yes. Yep. And they never work. I don't even know what work really would even mean for a diet, but they're not sustainable. And what ends up happening is people are harming their bodies, as you said, and exposing themselves to medical dangers that they don't even know about. Mm-hmm. And also, when you restrict your food intake, you mess with your metabolism. Our bodies are exquisitely built to maintain a steady state, right? So if I decide, like, oh, I know I'm going to do X, Y, or Z, like, low-calorie diet, and my body is starved of adequate nutrition, or, restricted from getting enough nutrition in, what happens is my metabolism is going to downshift, and go more slowly, mm-hmm. so that I'm not burning up as many calories just, sitting around. And once I resume eating a normal amount of food, my metabolism then doesn't, like, crank back up again to where it was. It stays in a lower state, because the body remembers the state of not having enough food. Mm-hmm. Does that make sense?
Yeah, it makes total sense. I get that.
Yeah. Yep. So, I think people don't really realize what, that there are longer term implications to dieting on your physical health. And certainly, one of the things we know about eating disorders, one of the biggest most well-known risk factors for developing an eating disorder is dieting behavior.
Mm-hmm. And especially, like how you said, different people in school and stuff, it's very easy to pick up what you see somebody do in school. So when you see somebody, like, maybe only eat a couple of things, like not what they need to be eating to fuel their body, then you're like, oh, maybe I should try that. And so it's not really good. Like, it's like almost like a follower type of thing. You follow what you see other people do.
Yeah, it's like contagious. Mm-hmm.
So what would you say would be the first step to recovery from an eating disorder?
So I think, for a lot of people, the first step is either themselves saying, I need some help, I can't control this, or this feels like, this is something that is hurting me and I can't stop it. A lot of times it's not even the person themselves that's first to say that, but a loved one. So, like, a best friend or a parent, or even sometimes teachers or coaches who are aware, sometimes a pediatrician. I feel, a lot of times, unfortunately, like, it needs to be pretty far progressed for another person to notice it, unless they really know what to look for. So I think the best way to get help for yourself, and to get help while it's still going to be an easier thing to recover from, would be as soon as you find yourself, you know, losing yourself, losing your values, not feeling well physically, emotionally, spiritually, to speak up and ask for help to somebody who's actually equipped to connect you to care. You know, we know that adolescents and young people in our country are really facing a mental health crisis. And I think people are more attuned to the mental health needs of adolescents because we talk about it more. There's still a huge number of adolescents and teenagers who are not getting connected to help.
Yeah, like you said, I think the first step is to realize it. And it does seem like it's pretty difficult if you don't really know about eating disorders, like if you don't know what to look for as an eating disorder. So I do think that it is good, like, you know, when you go to your yearly checkups and stuff. So your doctor, they don't specialize in it, of course, like your normal doctor, but they are trained to at least know when something isn't up. And so that's a really good way to realize it and making sure you keep up with your appointments.
Yeah. So, yeah, I mean, pediatricians get very little in the way of training on eating disorders. So my caution to any of you guys would be, you know, I never assumed that because a pediatrician didn't pick it up, or even if you talk to a pediatrician and they're like, no, you're fine, push. You know, like, you really want to go to somebody with eating disorder specific training. You can find certified eating disorder specialists if you look for that designation. It's called a CEDS. And also, you know, there are organizations that you can call for free if you're even wondering about it, who can at least get you referrals to people qualified to identify eating disorders, like NEDA, the National Eating Disorder Association, ANAD. There are a couple of other organizations as well. If you Google eating disorders help.
Yeah. And can you explain, like, maybe the next few steps of recovery from eating disorder?
Yep. So a really important piece is as you might imagine, the nutritional piece. And again, regardless of what size of body a person is in, having plenty of people in larger bodies who think, I have binge eating disorder, I must lose weight, or I'm eating too much. Plenty of people, regardless of their size and shape, aren't getting adequate and regular enough, consistent enough nutrition. So nutritional therapy, we talk about food as medicine in the eating disorder world. And that's an essential part of, recovering from an eating disorder, making sure that physically your body is safe and healthy, that your electrolytes are within normal ranges, that your heartbeat and blood pressures are normal. So I think, the physical aspects, which would include food and medical stability, would be, first order of business. We also, if you're a young person and you're still living with family, it's really helpful to involve family and family meals in the recovery process. So having loved ones also, meet with professionals so that they know how to help you in ways that are effective, and they know also, like, things to avoid that may be detrimental in the process. And then there's also the emotional part of it, right? And the trauma part of it. Plenty of people with eating disorders have some way, shape, or form of trauma. And, it's critical for a lot of people to get those issues adequately treated and addressed, again, by people who are competent to treat. things like depression or post-traumatic stress disorder, or anxiety disorders, in order to be able to fully engage in eating disorder recovery.
Yeah, and I really do think that the emotional is a big part in it, because it's like if you're not in the right headspace, you can't really truly recover. And it makes a lot of sense because when I was learning more and more on eating disorders, it's like it really starts in the mind, and it really starts on the way you view food. Because I was reading some stuff about how some people have like a fear of food, and if you have that fear, you can't really move on to the recovery until you fix the fear. And so I totally agree with you on that. Yeah.
Yep. Yeah. We now know that eating disorders are brain diseases, that impact our thoughts and perceptions and behaviors. It's not just like a phase that people go through, or laziness, or any of the other things that oftentimes get confused with what an eating disorder is.
Mm-hmm. And how do you know how eating disorders affect the body? Like, what do they do to like our body?
Yeah, so they affect all body organs. And again, depending on the type of eating disorder, the specific impact on specific organs can be different. But in general, brain health suffers. If your brain is malnourished, literally you lose brain cells and brain mass. The same holds true for the heart. We know that electrolytes can be altered, and sometimes to the extent where it affects our heart's ability to beat in, a regular way. So people can have arrhythmias, which sometimes can be potentially fatal. The digestive system can be definitely impacted by eating disorders. Bone health is a really important one, especially for young people. We are only able to mineralize our bones, get the minerals in up until around age, somewhere in the early to mid 20s. And if we're in a state of chronic energy deficit or calorie deficit, and we get past age 25, people are at much, much, much higher risk of developing osteoporosis at very, very young ages. We know that it affects the endocrine system, the reproductive system, the skin. So it can affect the liver. So it really, really has an impact on, the person's whole body. And one other piece of eating disorders that's really important to mention is that there's a high percentage of people with eating disorders that experience suicidal thoughts. And again, like talking about the crisis going on in teen mental health, it's important to realize that if you do have an eating disorder and you're having any thoughts like that, to go to the ER, talk to somebody immediately, because that's never a thought that is a normal thought, or that's not something to just sort of cast aside and say like, oh well, everybody thinks this every now and again.
That makes a lot of sense, because it seems like suicidal thoughts are getting more and more common along with eating disorders, and that's really scary.
Yes, exactly.
What resources are available for people who are struggling with these eating disorders?
Yeah, so there are treatment professionals who are specifically trained in eating disorders. And I would say, like, not every therapist who says they are an eating disorder specialist may actually be one. So, I generally tell people to, do your research. if the person has a specific certification in eating disorders, that's generally a good sign. Generally look for somebody with experience, because eating disorders are complex and oftentimes difficult to treat. There are community supports like the National Eating Disorders Association. There are treatment centers if your disease is, progressed, where you can get treatment, for example, for 3 hours a day, 5 days a week. There are residential treatment centers for people who are not able to do this on an outpatient basis, and even inpatient eating disorder treatment centers. And another resource for some people benefit from is there are 12-step support groups for people with eating disorders. I generally, if somebody is interested in that, recommend Eating Disorders Anonymous, which is, you could have any problem with food, to go there for free. It's peer-led, so you're not going to get a professional there. But if somebody has an eating disorder, I always recommend that they see a professional that is equipped to treat eating disorders. And that goes for nutritionists as well. I would say especially for nutritionists, because so much of the health world is focused on losing weight and quote unquote getting healthy, which, if you're a person who has an eating disorder, that's not going to be very helpful to you, because you have to treat the eating disorder, and mental health has to be part of getting healthy. And flexibility and acceptance, all of those things are important.
Could you come see a psychiatrist like you?
Yeah, there are outpatient providers. Some are psychiatrists, some are adolescent medicine specialists, some are therapists or psychologists, and most, I would say probably the majority of eating disorder professionals are outpatient providers. And now too, with telehealth being as robust as it is, people are finding access to specialists like eating disorder specialists, even if they don't happen to live close to, a larger city or a well-resourced place.
Mm-hmm. And how can friends and family members support someone with an eating disorder?
Yeah, so there are family resources as well. There are a lot of nonprofits that have emerged that support family members and friends. So Feast is an organization that is specifically for family members and loved ones. Family therapy is oftentimes an important part of eating disorder recovery. There's a particular form of therapy called family-based therapy that's sort of like the gold standard treatment for adolescents with anorexia. So it's like I said when we were talking earlier, it's pretty critical to involve family in the recovery process, and we know that recovery rates are higher when families are engaged in the treatment process.
Yeah, and it seems like it goes a lot smoother that way when everybody knows what's going on and everybody can really pitch in and play their part to helping it. That's very nice.
Yeah. Yep.
This interview was so nice. Thank you for being here, and I hope that it really helped maybe my listeners and stuff and different new listeners to really know what an eating disorder is and how to know if you have one, And thank you so much for being here. I really do appreciate it.
Thank you so much, Vivian, for having a podcast on this important topic. I really appreciate that.
Yeah, and if you guys want to check out her website and stuff, I'll make sure to leave it in the show notes so you can go see everything. And thank you so much for listening.